Hey guys, this is Dr. Yasmin, board certified OBGYN, and this is my puppy who's resting here while I talk to the world. I came here today to tell you all about hormones and women. I have seen in my practice, day in and day out, about women being scared and fearful about hormones. There's also a lot of misinformation, a lot of myths about hormones that they can cause breast cancer, clot in the lungs, clot in the legs. I may put on weight. I may go crazy. I do not like those hormones. This may also have stemmed something, a cultural issue, like we have never used hormones in our life. We don't want to use hormones even when we are going through that big M or the menopause or the perimenopause. We're just going to make this natural. That could just be cultural, or it could be generational. It could be like, I don't see that kind of fear to understand, and they're in about 20s and 30-year-olds, the early 30s, mid 30s. But I see more fear and misinformation or some kind of a doubt and uncertainty in the 40s, 50s, and 60s women in those decades. It may partially be that we have created that kind of a doubt and fear and uncertainty because there was a big study called the Women's Health Initiative almost 20 years ago, where we used oral hormones like systemic hormones, and it caused some bad effects in women like breast cancer, strokes, and heart disease. But this was mainly used in older women who were 60 and above, and it was a systemic synthetic hormones. So we have come a long way since that study. We have done a lot of research. We have found that hormones, mainly estrogen, it's almost like a fountain of youth, and also a small amount of testosterone, because men and women both have testosterone. Men have a lot more testosterone, and a woman just needs about 1/10 of the dose. So both estrogen and testosterone, they all keep trending down. There's a huge wavering in the levels of estrogen in your 40s, and by 50s, it's almost trending down. We have proven in a lot of studies that low estrogen can cause problems with your brain, like your cognition, your memory, and it can cause problems with your like heart disease, your arteries, your coronary arteries, the big arteries that supply blood to your heart. They could be getting atherosclerosis, which we call like leads to cardiac disease. Your muscle starts going down, your muscle mass. You're working out, you're eating all the right diet, but you're not putting on that muscle as fast as you want it to be. And your bone density, that also gets affected as your estrogen level goes. And also your areas, your intimate areas, like you get vaginal dryness, you can get pain with intercourse, you can have low libido because you have pain and you have dryness. You are not enjoying your intimacy, so it can lead to reduced libido. So all these effects can be controlled, can be reversed if we use hormones at the right stage with close monitoring. So I would definitely not recommend any woman to go to a hormone pop-up clinic and get some shots and some pills and potions and forget about it thinking I'm all fixed. It has to be a very close relationship with your medical provider where we have to assess your individual risks, because every human body is different. We have to understand your risks, understand what dosages you need and how much do you need to alleviate your symptoms, and monitor you very closely for the rest of your life or for however long you decide to be on hormones. So, my recommendations for y'all, please journal the symptoms that you're experiencing in your 40s or in your 50s or wherever you are, in whichever age at this stage in your life. Write down those symptoms and advocate for yourself with your provider. Go and ask them, why am I feeling this? Is there anything that you can do for me? If your provider is very busy or dismissive of your symptoms, you know what to do. You got to look for somebody else. Or you got to look for people who understand hormones and who know how to use hormones. Hormone use and to prescribe the right amount, right for you, individualized and customized for you, that's an art. It's an art and a science. So I would say It's not something to be afraid of. I want you all to research about your hormones, the changes in your body, and you can achieve the top quality of your life as you're navigating in your 40s, in your 50s, and in your 60s. Okay? So feel free to share this message with any of your family, friends, whoever will benefit from this. And I'll see you all again soon. Have a great rest of the day. Bye.